Hi there, my name is Berlin Waters, and welcome to my webinar on the Spicy Cat Project, a better way to manage cats. So a little bit about myself. I am currently at the University of Florida's vet school. I am a second year student there. Prior to vet school, I did get a master's degree in animal shelter medicine through the UF online program, and I was also a vet tech for about 10 years prior to that. And currently I'm enrolled in the UF Shelter Medicine Professional Certificate through vet school. So growing up, there was never any shortage of animals in my house. My family rescued many pets and wildlife over the years. I also helped my mom with TNR programs, so trap, neuter, release of community cats, and through that we fostered many litters of kittens. Throughout my life, I've owned 28 cats and counting, but I've also had 11 dogs and 4 horses, as well as 2 geese. So this unique experience kind of shaped my love and understanding of animal behavior. So before I get into it, I want to show this video from an organization called Dogs Playing for Life. And let's just take a look and see what these dogs are experiencing emotionally when approached. So we can see that when approached inside their kennels, these dogs are experiencing high levels of fear, anxiety, and stress, which is pretty common for most shelter pets. And the kennel itself can be a source of stress because that small, confined space, combined with an environment that's loud and full of energy, can lead to these stress behaviors like barrier reactivity, kennel aggression, pacing, panting, all kinds of stress behaviors. So we recognize that trying to assess their behavior and judge their temperament based on what they are like inside the kennel is not appropriate. And trying to attempt socialization inside the kennel with a dog that's being aggressive like that is not only very dangerous, but counterproductive. So let's see what happens when we get these dogs out of the kennel. So, as we can see, much happier, much more relaxed and not stressed, because we've realized that once you get them on a leash and bring them out into a more positive environment where they can not feel so confined and they have the freedom to express themselves, we see that often these dogs do a 180 and are no longer having that barrier reactivity or stress behaviors. Not because that these handlers are doing anything complex, but we recognize that the kennel itself is very stressful, and that simply getting them out and removing those stressors by removing them is all it takes to guide them into more positive interactions to allow them to de-stress. So what does this have to do with my project on cats? Well, the same basic principles that apply here apply to shelter cats. So what is the Spicy Cat program? It's an initiative aimed at transforming how shelters, vet clinics, and any cat caregiver manages fearful and aggressive cats through innovative handling and socialization techniques while deepening our understanding of feline behavior. Because these cats are not mean, they're just scared. So here's a video that kind of demonstrates what this program and project is all about. involved with all this? Well, through my master's program in shelter medicine, I started volunteering at my local shelter. And very quickly, I noticed that dogs took priority and cats at the shelter seemed to be treated like second-class citizens, unfortunately. I saw many cats having their needs completely neglected. I saw cats suffering in isolation for weeks to months at a time with zero interaction, all because they were showing these problematic behaviors, so aggression or extreme fear. I soon realized that very few people were comfortable handling cats like this, and that there were virtually no resources on how to safely and humanely handle aggressive and fearful cats in a way that promotes positive interactions. So I decided that this would be the project that I wanted to focus on. And so what I did was provide socialization and positive enrichment for these kind of cats, all while demonstrating how to safely handle these kind of cats in a humane way. So as far as the differences between dogs and cats at a shelter, again, it's clear that dogs are top priority, from the way they're marketed to the way we provide enrichment. Like these photos here are from local shelter websites. You can see that either these pictures are professionally taken or they're very well done at the shelter with dogs that are dressed up. They have nice bandanas. They're out in a nice area like the grass play yards, things like that. A lot of these dogs also have very cute bios with lots of information about them. Dogs at the shelter get lots of daily out-of-kennel time. They are walked multiple times a day. They have access to play groups and play yards, and a lot of shelters nowadays have very robust foster and volunteer programs for helping with this. And this is awesome. This is exactly how it should be. However, we can't only do this for half of our shelter population. We need to include cats in these things. If a dog at the shelter was never taken out of their kennel and never taken for a walk, there would be public outcry. Yet I've seen cats sit in the corner of a kennel with zero human interaction for literally months, and yet nothing happens. So again, cats at the shelter, have very poor photos most of the time. A lot of times they're either taken of them scared in the back of their kennel, still in traps. I still, to this day, see pictures of cats being scruffed on their intake photos. Most cats have very limited information on their bios. Majority of the time, cats don't get any out-of-kennel enrichment. And if they are aggressive in any way, they get little to no human interaction at all. And these kind of cats often are either inappropriately sent out as barn or working cats, despite never being an outdoor cat before, or unfortunately they are euthanized because they are considered unadoptable. So simply treating cats this way just because they are exhibiting aggression is unacceptable. And I hear it all the time from every aspect of the animal welfare field, from vet techs to staff to veterinarians and the general public, that people assume that this cat is acting aggressive, it must be mean, feral, unsocialized, or they don't want to be messed with, they need time to decompress, or this cat just simply doesn't like people. And this is so harmful. This overall negative perception of cats, especially the aggressive ones, again, is seen all across all fields. And this only perpetuates the negative connotations that people have about these cats. And so they continue to suffer and continue to be on the back burner of behavior programs. So what is the problem here? Why is there such stark differences between cats and dogs? Well, it all boils down to just a lack of understanding of cat behavior in conjunction with a negative cultural perception about cats that we have in general. And it really is an issue when you start to notice it, that these double standards between dogs and cats is probably one of the most frustrating aspects of the work I do. But when you look at the intake of cats at the shelter, Almost all of them are owner surrendered for an owner-related problem, not because these cats were mean or aggressive in the household, but because the owner is moving, or they have allergies, or unfortunately the owner passed away, and so now the cat is at the shelter when previously in their old home they were sweet, loving house cats. I like to show this photo too because it highlights the stark differences between how cats and dogs exhibit their behaviors. So if you look at the dog on the left, most people can recognize that this dog doesn't look happy. They look sad or depressed or scared. Whereas the cat on the right, most people will say that cat looks mean, it looks angry, maybe it's feral. But really, although that these two pictures look very different, these animals are feeling the exact same thing, and that's fear. And it's important to realize that cats express fear in a very different way than dogs do. Dogs have the sad puppy dog eyes that people can relate to and empathize with. Cats, on the other hand, are also a prey animal, and that plays a big role in their fight or flight response because cats, as prey animals, need to defend themselves. So when they're scared, they do act out aggressively. They hiss, they growl because they need to defend themselves because they feel like they're fighting for their lives. Whereas dogs are not prey animals, so they do look sad and have the puppy dog eyes. So another big issue is, dogs, when they're stressed, they let you know. Dogs in the shelter are very loud and obnoxious, and the squeaky wheel gets the grease. It's hard to ignore a dog that's pacing and barking and panting and running around its kennel. That's hard to ignore. Whereas a cat, a lot of times, if they're not growling or hissing, they're shut down and they're hiding in the back of their kennel. And that is easy to ignore in a busy, stressful environment like the shelter. So a lot of times they get overlooked because they aren't complaining like a dog would. It's just recognizing that although they are quiet and although they express their fear and frustration in a different way, it doesn't mean that we can just ignore them. It's also important to understand that, if you've ever worked at a vet clinic and seen a fractious cat, again, when you ask those owners, how are they at home? Oh, they're the best cat ever. They're so sweet. Like recognizing that, yes, these cats aren't inherently mean. They're just terrified. Again, from their point of view, they're fighting for their life. So my solution to all of this, we need to provide better education and training on recognizing and understanding these feline stress behaviors, whether you're at a shelter, a vet clinic, a TNR clinic, or just adoption counseling in general. We need to have proper handling and socialization techniques, better marketing of these cats because these cats don't present well in the shelter, especially the aggressive ones. And if we can market them in a way that's appropriate for them, we can get them adopted quicker. Number 4, a feline facilitator. This is someone who is well versed in cat behavior and an advocate for the cats in the shelter environment so that they don't get forgotten about. And then lastly, adoption counseling. This is the second to most important thing. Once they come out of the shelter, you want them to remain in that home. You don't want them to be returned because an owner didn't know how to handle them. So first up is education and training. So one thing I want people to realize is, I hear it all the time where people talk about this decompression phase where a cat comes in and they just need time to decompress. They don't want to be messed with. And then they literally go untouched by anyone for days to weeks to even months. And rarely do they improve with this technique. And usually I see them get worse because they're in this continued state of decompression, but nobody's helping them. So the decompression phase is a myth. We should not think that way because cats entering the shelter or the vet clinic experience what I like to call shelter shock. They are in this heightened fight or flight mode trying to figure out what's going on. And at this time, there's no decompression happening. It's only fear and suffering. These are the cats that need intervention immediately because scared cats don't want to socialize on their own. They're not going to just come out when they're ready. And if you wait for that, it could be weeks or months for them to build confidence on their own. And so what we need to do is initiate intentional socialization. We can't just wait around for them to, again, build that confidence, because a cat that's scared would rather hide all day than choose voluntary interaction with a stranger. So relying on this hands-off approach, or relying solely on anti-anxiety meds like gabapentin, is not really a neutral approach, because it only prolongs that suffering and prolongs that stress, and oftentimes it just worsens their behavior. So being able to recognize feline stress behaviors is the first step in providing quality care for them. These charts by Fear Free are great resources. They have one that's more of a generalized one that ranks cats from 0 to 5 on their level of fear, anxiety, and stress. And each level gives a really good breakdown of what these cats are experiencing at each level. And same with this frustration scale for shelters. I like this one too because it discusses feigning sleep, which is a big stress behavior in shelter cats that often gets overlooked because people assume they're just taking a cat nap, but really they're feigning sleep, meaning they're sleeping as a way to cope with the stress, but they're not getting any kind of REM sleep. They're just kind of looking like they're sleeping as a way to hide away from the world. And then next we have, Feline VMA and Fear Free both have really good cat certification programs where you can learn about just the basics of cat handling, low stress techniques, and what environmental triggers kind of set cats off and how to reduce those. So I highly encourage anyone who works with cats to go through these programs. So why is this important? Well, for any animal in our care, we know how important mitigating their stress is and providing them with good quality of life while they're in our care, because that's what we want. We want our animals to have good welfare and a good life. We know that stress in cats is the number one factor in disease transmission, from URIs to ringworm. So a less stressed cat is often healthier. They have a better quality of life, and not only mentally but physically. Lower stress also helps reduce recovery time if they are getting any kind of spay or neuter at the shelter. And then implementing these techniques in this presentation will allow us to better assess the cat's true behavior. And by interacting with them and handling them on a regular basis will allow us to conduct more predictable meet and greets for those adopters who want to get the cat out of the kennel and see what they're like, see what their potential new companion is going to be like in the home environment. So if we handle them regularly, this will make things much smoother, much easier. And when we do this is going to increase adoptions. A healthier, happier cat who is okay with being handled is going to be adopted quicker. Next up is low stress handling and socialization. So making sure staff is well trained in cat behavior and handling, understanding their body language. It's critical to knowing how to properly handle them. Simple things like approaching a cat slowly and being very quietly and letting them greet you first is going to make a huge difference in how the interaction goes. Remember things like, using towels to pick them up as opposed to your bare hands is going to prevent bites or scratches. And bites and scratches in the shelter environment can lead to quarantines or bite holds, and that's only going to prolong their stay and prolong their stress. But once we know how to physically handle these cats safely and in a low stress way, we can better assess their behavior, and that's going to tell us, what kind of enrichment they need. What will they benefit most from? And it's important to realize that no type of handling in the shelter or the vet clinic is going to be 100% fear-free, because those environments are inherently fearful and scary to cats. But what we can do is use techniques that minimize that stress. And this is true of cats at the vet clinic too, If you have a hospitalized cat and all you ever do is go in their carrier or their kennel and poke and prod them at each meeting and greeting, they're going to associate that with pain and fear, and they're going to only worsen from there. But if we take the time to implement these easy techniques and just interact with them positively in between, we can minimize their fear. It's going to make them much more easier to medically manage. We've all seen it with the very nervous dogs who are scared. We always take the time to get down on their level and go really slow with them and try and coax them out and just pet them. And even hospitalized dogs, we take them out on walks to get them some fresh air, things like that. But we don't do any of this like with cats, especially hospitalized ones. But it's important to realize that you can unhook a cat from fluids and bring them into a quiet exam room and interact with them positively without giving them medications. You can sit there with a cat inside their kennel and offer them churu without, in between medications. It's just about interrupting that stressful cycle, showing them that you're not anything to be scared of, and help guide them through those interactions. Next up is out-of-kennel time. Primary housing for cats is a major shortcoming for most shelters. Shorelines that are metal are often loud, they're very small, and have no elevated surfaces, yet the more modern ones with shelving kind of lack the space needed for cats to move and stretch like they want to. And with most housing units being less than 11 square feet, and paired with the fact that aggressive cats don't get much positive human interaction, it's solitary confinement, honestly. And for years, many people have been told that removing a cat from their kennel is inappropriate for socialization because, many people still believe that the kennel is the cat's safe space, when this is just not true. In reality, it's simply the only space that we've given them. We didn't really give them a choice, so with no alternative, they can't do anything else but to sit there and hide and choose to not interact with people. We can't really take control of this cat's lives completely and decide where they're going to live, what they're going to eat, what vaccines they're going to get, and then claim that socialization is going to be left up to them. Given the choice, yes, a fearful cat is going to choose to hide all day, every day, versus voluntarily interact with a stranger. So waiting for a cat to come out on their own is going to take days to weeks to even months. So withholding support under this guise of consent isn't neutral, it's not compassionate, it's simply avoidance. So again, these cats didn't choose this situation, and many will not improve in a reasonable time frame without proper guidance and support. The moment they enter our shelter, our care, it becomes our responsibility to guide them through this very difficult transition, even if it does mean brief, discomfort and stress by getting them out of the kennel. I like to think of it like dropping off a kid at a new daycare and watching them run into the corner and cry, and then the daycare staff saying, well, we don't want to go up to him because he doesn't want to come up to us, so we're going to wait and see, wait for him to consent to interacting on his own, No, we wouldn't do that, because in our eyes, we need to show that little kid that it's going to be okay, we're here to help you. And the same goes for these cats. We need to help them. We need to intentionally interact with them in a way that builds trust and confidence. These cats, same with the child, what they, desperately need is someone to tell them it's going to be okay and provide structured support. That's what's going to help them cope. That's what's going to get them out of hiding. And for most cats, socialization inside the kennel, again, like we saw with the dogs, isn't appropriate because that's going to heighten their fear, that's going to make them feel cornered. So removing them from that stressful kennel environment is essential. And often it's the only way that real meaningful socialization is going to happen. And 9 times out of 10, just simply moving a cat from a stressful kennel into a quiet enrichment room is going to change the entire dynamic. Even the most aggressive cats that you think will never improve, moving them into a quiet room and just giving them a second and showing them you're here to help is going to dramatically change their behavior and build trust and confidence within minutes. This is my original research that I conducted during my master's program. So what I did was I would go to the shelter and identify the most aggressive cats, the most fearful cats with the highest FAS levels, and I would remove them using low stress techniques that were appropriate for their temperament. I would bring them into an enrichment room and socialize with them using my innovative handling and socialization techniques. And I would spend 30 to 90 minutes each session with them, and I did that for 3 to 4 times a week for about 4 months. And what I found was that getting them out of the kennel and into a calm enrichment room dramatically changed their behavior. Again, even the most aggressive cats became very sweet, loving pet cats within just a few minutes. So 87% of the cats that I worked with improved by 2 FAS scores or more. What I should have included on this original poster was the fact that actually 100% of the owner-surrendered cats that I worked with showed some kind of improvement each session. Not a single cat showed regression at all. They all got better each session. And this research project was 4 years ago now, and since then I have refined my techniques and worked with more shelter cats, and I've started incorporating feral cats into this program. And what I found was that my techniques have worked tremendously well, and I have had a lot of success with all the cats that I work with, including feral cats. And now I would like to show some case studies from both my original research and from my more recent continued research. So first up is Azure. He was one of the very first shelter cats that I worked with. He was a cat that was brought to the shelter, owner surrendered, and he was in the shelter on September 5th. Observing him initially, he scored a 5 out of 5 on the FAS score chart, exhibiting offensive, aggressive behavior. Because of his behavior, he was moved off the adoption floor and brought into a holding room for other cats that were showing these problematic behaviors. He was also placed on gabapentin for kennel stress. And so he had been there for about a full month using traditional hands-off or medication-only techniques and showed little to no signs of improvement. So once I started working with him about a month after, I wanted to get him out and see what he was really like. So this is what his cage card looked like. Not very pleasing or pleasant to potential adopters. And then this is what he looked like every day, all day when I saw him. He was just hiding in his feral cat box, never coming out. So this is Azure at our very first session inside an enrichment room. I transported him in his little feral box. As you can see, he is much more relaxed here. He was ready to come out, so I slowly opened the kennel, and already he was ready to interact. He was much more curious than he was inside his kennel. There was no hissing, no growling of any kind once I moved him in here. I was able to let him greet me and then start petting him, and you can see that he almost immediately turned into a totally different cat, And this kind of enrichment is super important for these cats who hide all day, because not only is it mentally and emotionally stimulating for them, but physically too, because he probably hid in that box all day long, never stretched his legs for the past 4 weeks, because he was scared. Can you imagine if we let this happen to dogs? We just simply wouldn't. But with cats, we let it slide. But really, this is critical for him, for his emotional well-being. And so this picture on the left is actually him the very second I put him back in his kennel. He came out of his kennel box immediately and started eating. And that is a huge sign of a less stressed cat. And actually the staff member walked by and saw him and said, "Oh my gosh, is that Azure? I've never seen him come out." So clearly this kind of enrichment can have immediate positive effects on these cats. And all it took was someone showing him that, it's going to be okay. And then here's him during our Christmas photo shoot. He let me put collars on him, like just a totally brand new cat after, 5 minutes of positive human interaction. And after this, he was able to be taken off of gabapentin completely because he didn't need it. He was no longer stressed anymore. Next up, similar case, we have Ink here. She was 5-year-old owner surrendered cat who was admitted to the shelter August 10th. Upon initial assessment from outside of her kennel, again, she was hissing, growling, spitting. She would lunge at anybody who opened the kennel door. She also was on gabapentin for kennel stress and moved off the adoption floor because of this behavior. So I didn't get to start working with her until September 26th. So that's over a month and a half that she went with traditional methods of socialization of, hands off or waiting for them to, open up on their own and giving gabapentin. And she continued to decline, actually. Staff literally told me I wouldn't work with her. She's evil. And that broke my heart because, not only was she suffering from severe fear, anxiety, and stress, but she had no one, to back her. She had no one advocating for her well-being. And that's unfortunately the case for a lot of shelter cats that are showing aggression. Unfortunately, at probably every shelter I've worked with, I've had at least one staff member describe a cat in this way. Like, oh, no, that cat is mean. They're evil. Don't touch that cat. And how do you expect to adopt out these kind of cats when even your own staff is talking about them in such a negative light? So, I don't say this to condemn, the staff members, but to highlight and demonstrate how important it is for people to understand and recognize why these cats are behaving the way they are. Again, not because they're mean. They're just terrified. So let's see how she did. So this is actually how she was all the time. She didn't want to hide in her box. She just liked to sit on the top corner and hiss at people. And then this is our very first one-on-one interaction. Again, she's much more relaxed. She's at the front of her kennel. She leans into my petting her. She is honestly relieved to have positive human interaction for the first time in a month and a half. And clearly, she is a sweet house cat who loves her enrichment time. And she is just like one of those dogs showing barrier reactivity. She feels stressed when inside the kennel. She doesn't feel like she can, express herself like she wants unless she's out of that kennel and out of that confined area. Next up is Ryder. Again, owner surrendered, very stressed, very scared. She was very offensively aggressive and defensively aggressive. So she was brought to the shelter October 25th. I didn't start working with her for over a month. And here is what she looked like. Okay. So I decided, well, let's see how she is outside the kennel. I used my towel to safely remove her because I felt confident removing her with a towel instead of putting her in a box first. And then this is her immediately after being moved into a room. I'm not having to keep her next to me. I'm just, she's just voluntarily sitting there, enjoying getting pet for the first time in a positive way in over a month. And I tried with the little mini hand there too, and I found that that's not really helpful for a lot of cats who are very stressed because cats aren't stupid. They know that's not a real hand. All they know is they see some scary device coming towards them that they don't know what the heck it is. So I have started not using that. I've discontinued using those and just immediately remove them from the kennel and get them into an enrichment room because that's what makes the most dramatic effects. And these case studies are not one-off cases, one-off cats where, I just happened to get a cat that, responded well. No, this is representative of every single owner-surrendered cat that I work with. So for my last case study, I wanted to show Chorizo. And Chorizo was a feral cat brought to the TNR clinic that I work at. He was brought in to get neutered and as well to assess multiple severe bite wounds that he had all across his body and on his legs, many of which were really infected. And because of his temperament, he was very difficult to medically manage. Because of his infections, we had to have him on a lot of medications, and we were mixing them into his food because he wouldn't let us touch him, things like that. And so, he was very hard to manage. And so the first week he sat in his kennel in his feral box and just hissed and lunged and spat at everybody who went by. And so I decided the second week I was like, okay, let me see what I can do with this cat. So here is me working with him for the very first time. So I brought he was living in a dog crate, and then he also had a feral box inside of his cage. And all I did was, remove that box out of the kennel and see if I could assess him. So here I am getting my towel and removing him, because he didn't seem to want to come out on his own. And with feral cats, I just like to wrap them in a towel first because, we don't know what their previous, history or socialization status is. So it's safer to just bundle them in the towel wrap and assess them that way. Pretty quickly, I was able to tell that he was not going to fight me. So I was okay with, starting to pet him and loosening the towel pretty quickly. And all I'm doing is holding on to him, petting him and talking to him gently, showing that I'm not there to hurt him. I'm here to help him. I'm here to show him that things are going to be okay. So if you look closely at his little paws, you'll see he starts to knead. And he's already enjoying being pet. He's not freaking out. He's not, regressing. He's not being aggressive. All I did, people often say, oh, I'm the cat whisperer. You're using your cat magic on him. No, I'm just showing him compassion. I'm just giving him a chance to show that he's in a safe spot and giving him a chance to open up to me, and reassuring them is all it really takes. And this is Chorizo within the next couple days. From then on out, he was no longer aggressive at all. He no longer needed his meds mixed into his food because we were able to easily give them either by mouth or just in treats. We were able to clip and clean his wounds without sedation. We placed a catheter without sedation. He was able to be handled completely with minimal restraint because he just opened up to be this wonderful cat. And if you never give feral cats the chance to, get that reassurance or the chance to express their true selves, then you'll never know. And the same with hospitalized cats. If all you do is negative, things to them, like giving them medications or injecting them or things like that, if you don't give them a chance to have positive interactions, then they'll never be able to relax and express themselves. So, and again, this was not just a one-off case with a feral who just happened to, be successful with this technique. This is actually more often how most of my feral cats sessions go more often than not. So I did want to bring up the topic of feral cats because most people tend to assume that feral cats can't be touched or can't be socialized or handled at all by humans. But if we think about the process of being trapped and transported for TNR programs, it's probably one of the most traumatic experiences that a cat can face. So judging their behavior and temperament during this moment of extreme fear is not appropriate. It's not an accurate reflection of their true behavior, and using it to judge them is neither helpful nor fair. In fact, evaluating a cat's behavior while they are confined and terrified in the traps is even more stressful and counterproductive for them, and again often leads to these incorrect assumptions about feral cats. People think of them as wild animals, but they're not. They are just domestic cats experiencing extreme fear. And so, this isn't to say that everyone should start trying to socialize and, work with feral cats, but I'm saying, when you do, it's not fair to just, put them in this category of can't, bother with them, when a lot of cats are just scared. So, in situations like Teresa, where they need to be hospitalized, they need medical management, this is when it's appropriate to try these techniques and to assess them appropriately so that you can improve the care that you're providing and decrease their stress while they're in your care. Again, it's not to say that everybody should try if they are hospitalizing a feral cat, because working with these kind of cats can be very dangerous if you're not properly trained. It does take a lot of skill and practice, and in order to be successful at handling any aggressive cat, you need to have the utmost confidence when working with them, because any ounce of fear or hesitation with them can result in serious injury, and they can sense your fear, and so that's just going to further escalate things and stress them out. But again, if you are confident and really want to work with feral cats, it's really not that difficult, like people assume. I'm a firm believer that outdoor cats should live outdoors if they are healthy and happy and sterilized. But again, for cases like Teresa, if they need that management, this is a way to provide very high quality care for them, as opposed to euthanizing a cat who we are just assuming can't be handled. And again, I implement these techniques regularly because I volunteer with a TNR clinic, and I, time and time again, do see dramatic positive responses, and I'm able to help reduce their stress, reduce their recovery time, and just improve their lives. And multiple times I've been able to socialize these cats to where they become house cats. There was a cat who was going to be euthanized for glaucoma because he would have needed both of his eyes removed. But we took him out and we assessed him in an appropriate way and realized this cat can be adopted out into a loving home because he is the sweetest cat. You just need to give them that chance to show who they really are. And the techniques I use for these cats, I'll discuss in a moment, but, it's nothing crazy. I'm not even using cat gloves. All I use is towels and a towel wrap that I came up with, and it works very well. And again, just wanted to reiterate that these cats, especially feral cats, they're not inherently mean. They are just terrified. So these are the two techniques that I came up with. The Superman towel wrap and the bundle and bond are techniques that I developed to safely and humanely handle cats of any temperament, whether they are very aggressive or feral, but they also work with the cats that are frozen in fear. And I use the Superman towel wrap really on any and every cat that I remove from a kennel because it's safer and it's very easy to use. So with the bundle and bond, that is just a technique where I use the Superman towel wrap, but then incorporate structured positive socialization, and primarily use that with feral cats or those that are too scared that they're going to bolt if you were to just let them go. But the majority of aggressive and even feral cats that I work with don't even need the bundle and bond. They just need brought into a quiet and calm environment. So when people hear me say, talk about socializing cats, they often think that I'm using complex strategies to tame these cats, when really all I'm doing is petting them in a calm manner and maybe using a towel wrap to hold on to them. And with the bundle and bond, again, I'm using it like a leash equivalent, because, if you leash those, fearful dogs like we saw in the beginning, and then just let go of the leash and open their kennel, they're going to run away. You have to hold on to them. Yes, they initially resist and don't want to, but, you have to get over that, barrier of fear and once they make that, contact with you, they just need a second to calm down. And that's what the bundle and bond does. It allows me to restrain these cats in a humane, safe way that gives them enough time to calm down, to realize nothing's happening, they're in a safe spot, and I'm here to help and give them that reassurance. And then, again, most cats don't need the bundle and bond. Usually, even if they do, all it takes is a few minutes, and it dramatically decreases their fear and builds their confidence, so that over time, these cats that were once very aggressive or shut down can finally realize it's okay to start socializing on their own. So some important reminders when it comes to handling or socializing any cat, whether they're aggressive or not. Working with cats can be a life or death situation because of how flighty cats can be, and their escape mechanisms are unlike any other. So first and foremost, you have to always secure your room before getting any cat out of a cage or anything. You can't give them a chance to escape because they will. And there's absolutely no reason to put that cat's life at risk when securing a room is a very simple and easy task, and having that reassurance that if they do get loose, they're not going to escape. That's just rule number one. So what does a secure room, look like? Well, it involves a room that has closed doors that they can't open on their own, minimal furniture for them to get in, on, or under. Realize that cats can almost climb the walls, and so if they are able to jump up and get onto a top of a cabinet and get into ceiling tiles, they certainly will. It has happened before, and can be life or death because it's almost impossible to get them back out. And then good communication is a very important part of this, because you need to let people know where you are and what you're doing so that people don't accidentally open the doors if the cat is roaming loose, and that cat gets out. And it allows people to kind of decrease the foot traffic around the room, making things extra quiet, because any unexpected guests are going to just kind of put that cat in a panic. And then next is never transport a cat in your arms. This is an unacceptable practice, in my opinion. No matter how good you think you are at holding cats, no matter how short of a distance you are moving them, never transport a cat in your arms from room to room. Again, if you've ever tried to hold on to a cat that is freaking out, it's virtually impossible, and they will scratch you and bite you, and it just escalates things when they don't have to be. So always just put them in a secure container. It's very easy, especially with my Superman towel wrap. Takes 3 seconds. There's no reason not to. Again, it's just not worth the risk. Never bare hand a cat. Occasionally, if they are, a 0 out of 5, and I am very familiar with how this cat's behavior is, then I will not use a towel to move them into a carrier. But anything other than that, I always use the Superman towel wrap or some kind of towel wrap to remove a cat from the kennel. Because even if they are sweet, the act of physically restraining them when they're not used to it can send them into a panic, and that can lead to bites and scratches, and we know that's never good. So lastly, when we're working with any cat, again, no matter their temperament, always prepare for the worst. Always assume that there is a potential that they're going to escape, because it's better to be safe than sorry. So always have the tools and supplies necessary to catch a cat if they were to get loose, because if they get fractious or unexpectedly get spooked, it's very hard to contain a cat like that. So as long as you have a secure room and they can't escape, that will give you the time needed to fully assess the situation and prepare to catch them again. But if your room is not secure and you don't have any tools, then again, that's a life or death situation, when all these are simple steps to prevent disaster. So here are some examples of how I use my Superman towel wrap and how it's very effective. Here we can see me using it to restrain a cat that I had just caught inside of a cat holding room. So see, even as they try and jump away, I still have a really good grip on them. And they are unable to escape because of the way that this towel wrap is. And then here is what I consider the bundle and bond. All I'm doing is holding them in the Superman towel wrap, but then applying the positive interaction. So gentle pets around the head and neck, softly speaking to them while keeping their head up. That's really what's going to help build trust with them and build their confidence pretty quickly. And then usually within minutes, I'm able to loosen the towel wrap with them. It's also really good for scared or feral kittens. Socializing them, cleaning their eyes. The Superman towel wrap is, it doesn't need to be nearly as tight as with an adult feral cat because they're kittens, but it also helps make them feel nice and secure. And then lastly, this is just a good example of me using the bundle and bond on a feral cat. As you can see, I'm not escalating their fear in any way. This is just a way to help create a positive, structured environment to initiate contact and initiate positive social interaction so that they can start that trust building. All right, next up is marketing. So it's important to realize that these cats do not need to wait for the perfect adopter because how they're acting at the shelter is not representative of how they'll act once they're back in a home environment. Think of it like a fractious cat at the vet. We know that they're acting this way because cats are stressed at the vet. They're scared at the vet because they hate the vet. And the same thing goes with shelter cats. They're acting this way because they hate being at the shelter. So make sure that these cats are marketed appropriately and up for adoption as soon as possible because the best behavior modification program for them is to go into a home environment and leave the shelter. We adopt out aggressive dogs sometimes, dogs with bite histories, and those dogs do pose a threat to human life and the public. And I don't say that to vilify these dogs. I've had dogs with bite history, but we know in the right conditions, these dogs aren't a threat. Same goes for these cats, except there's no threat to human life. A cat's not going to maul a little kid to death, and we don't need to worry about that because these cats are not inherently mean or aggressive. They're just scared because they're at the vet or at the shelter. So when they go back into the home environment, we don't really need to worry about these aggressive behaviors persisting so long as we give them proper adoption counseling. But that goes with any cat that's scared and leaving the shelter. So here are some ways that we should be marketing these cats so that it is going to help them get out of the shelter quicker. Going to the vet analogy, if you took a bunch of pictures of your cat at the vet at their last visit, would they look good? Probably not. They probably would look scared. And so we need to take extra steps to market them in an appropriate way so that they do look good and so they look more adoptable so that they can get out of the shelter. So some of this, simple things like better intake photos. It's really not that hard. I do photo shoots at shelters, themed photo shoots for holidays and things like that. And I do it with my iPhone, and I'll just remove cats from their kennels, put them in the enrichment room, and I was able to photograph probably over 24 cats within just the afternoon and get really good photos of them to market them better because, they don't look good in their kennel because they're scared. So bringing them into enrichment rooms, not just for photo shoots, but like when you were socializing, if those enrichment rooms can be seen by other people walking by, potential adopters, they like seeing cats interact with people positively. That is, just like people like watching dogs in play groups. That's how they choose who they're going to take home. Trying to be better about incorporating fun bios on cat cage cards. It doesn't take a lot. If you don't even know this cat, use AI. I made this whole cage card with AI within a couple minutes. It gives you a great synopsis. I was able to work with this cat a couple times, so I knew a few things about his behavior, so I added that in. And then QR codes are everywhere now. If you have a bunch of photos or videos of them in an enrichment room, put a QR code so that people can scan that and link it to those videos and photos so people can catch a glimpse of what this cat might be like outside of the kennel environment. Appropriate language, as I mentioned before, there's all these negative connotations surrounding cats in general. So, using cage labels like caution, kennel stress, like that doesn't look good to adopters. Use things like, I'm friendly, I'm just scared, or I'm experiencing shelter shock, take me out, or something like that. Using more positive language around cats is going to help, create a more positive look for them and help them get adopted quicker. So that is all very simple, very easy ways to appropriately market cats that don't necessarily present the best inside the kennel. Next, we have our feline facilitator. Pretty much this is a position that I advocate for shelters, much like how some shelters have a behaviorist for the dogs. Most shelter behaviorists are dog focused, so having someone who, even if they're not a behaviorist, just someone who is well versed in cat body language and handling them to kind of oversee the management of them, so that they can teach and implement low stress techniques like outlined in here. They can help with providing proper cat enrichment. They can train other staff members and volunteers, and then again just be kind of a cat advocate, because we know that most of the time dogs take precedent in the shelter. And lastly, if we want these cats to be adopted and stay adopted, we have to provide adoption counseling and support for all pets that we adopt, not just the cats, not just the aggressive cats. All cats should have some form of adoption counseling, because transitioning a cat from one environment to the next is very stressful for them. It's a very scary time. And, guiding new adopters on how to transition their cat from the shelter and back into a new home is crucial. Adoption counseling can be done one-on-one. You can give them brochures or a phone call, websites, things like that. Just knowing that they have support, these adopters have support, is a big factor. If they have questions or concerns, knowing they can call someone or look up this information online can be really helpful in preventing returns. Again, for fearful and aggressive cats, this is crucial, because again, we understand that how they're acting in the shelter is not how they will be in a home, but during that transition from shelter to new home, they still don't know what's going on. So they still might not act, they might not act as aggressively, but they'll still be pretty scared. So we just need to counsel people on how to make that transition as smoothly and safe as possible. Again, they don't need to wait for the perfect adopter. Just because they're aggressive here doesn't mean they'll be aggressive at home. They just need, a little time, sometimes a little extra time than a friendly cat. But this is just a very crucial step in getting these cats adopted. So here is a snippet of my adoption counseling brochure that I came up with. It's also available to download on my website. It has a lot of good details, quick blurbs on how to transition cats. I also have an entire section on my website about the basics of caring for cats and adoption counseling for new owners. And, time and time again, I see adopters bring home a new cat, and what they do is they'll let them go just in the whole house. And what happens then? The cat is freaked out because it doesn't know where it is, and they run and hide under a bed, up under the couch or something like that, and they'll hide for days because they don't know what's happening. And so at this point, owners can't reach them, they can't interact with them, and they become very frustrated because they got this cat that they were told was sweet at the shelter, and now they can't even touch them, and they're freaking out in the house, and they might become aggressive because this is not the appropriate way to transition a cat. So guiding them on how to do this so that we prevent this panic and this fear and this frustration with new owners is going to help. So timely intervention is critical. Providing a small, quiet environment for this cat to go, like a bathroom, is essential for helping them through this transition, but still allowing the owners to be able to see their cat and interact with them. Again, just because the cat left the shelter, yes, they're probably going to do better than in the shelter, but going from new place to new place is always stressful for any cat. So we need to make sure they're acclimated appropriately. Otherwise, adopters are not going to be happy, and we need to make that transition as smooth as possible for happy adopters and happy cats. So in conclusion, let's listen, learn, and lead with compassion. Yes, it does take time. It does take effort and learning and training, but that's why we're here. That's why we got into this field, to provide quality care for animals in need. And as animal caretakers, we should always be striving towards better standards of care, and this is the next step. When we lead, others will follow, because we are the professionals in animal welfare. If you have any questions, you can contact me through my website, thespicycatproject.com. I also have a YouTube channel. This is the QR code for my website. Feel free to check out all my adoption resources there. I have training videos, other webinars, and things like that. So thanks for watching.